Spinal stenosis, not a condition you hear discussed very much, and it often slips under the radar, but it usually represents the end stage of a condition of gradual degenerative change over many years in the lumbar spine. And the reason it can slip under the radar is that people will frequently have a history of severe episodes of low back pain with or without sciatica, and significant periods of disability related to that. And what can gradually happen over time, which is contrary to what you might expect, is that the spine can self-stabilize. So the more degenerative change you get, the stiffer the joints get, the thicker they get. So actually the body responds by forming extra bone formation, and that has the effect of solidifying the joints and almost fusing them. And that has a couple of effects. One, it helps to stabilize the spine, and often reduces the acute episodes of pain that people have complained of historically in the past. So that can seem like a good thing, but if it's sustained over time, unfortunately, the extra bone formation can narrow the space for the nerve roots, either the nerves that come off on either side, which will go down one side of the leg or the other, or more severely, if it compresses the spinal cord, then you can get symptoms related to spinal cord compression. So, as I say, the thing to look out for here when they present clinically, and today's video was prompted by a recent case we saw of a gentleman in that category, and his primary symptoms were burning leg pain at night on both sides. He could function reasonably well during the day, but burning pain at night, partly eased by change of position, but nonetheless significant irritation. And burning pain is always a strong clue of some nerve dysfunction. It could be what's called a neuropathy. So there's another condition which is non-mechanical called a sensory neuropathy, and there can be different causes of that. Probably the best known of those are diabetic neuropathies, but there are other kinds of neuropathies that just make the nerve sensitive. But this particular scenario of spinal stenosis, there usually is a long history of recurrent back pain, but usually with the new type of symptoms that people are describing, they don't associate it with back pain. So very often they don't make the link between that chronic pain, back pain, or episodic back pain and the current symptoms. Other kind of symptoms that can occur are heaviness in the legs, and particularly if people are standing or walking for long periods of time, and they feel the need that they have to sit down and take the pressure off. And they often only need to sit for a minute or two to give them ease. But the mechanics of that are when you sit down, you bend through the spine, and that very often is enough to open up enough space to take the pressure off the nerve. So you can get quite immediate relief of symptoms and then go off and move again. But it depends on the severity of the stenosis, of the narrowing, as to what your capacity is. If it's only very intermittent, people don't notice it. But if it gets more persistent and frequent, then obviously they start to pay a bit more attention to it. And that's not to be confused with peripheral vascular disease, where the circulatory issues into the muscles of the legs, which limit the ability to walk. So you do see these kind of patients, these stenotic patients, and sometimes they take a bit of convincing that the symptoms are originating in their spine, because they usually think it's something circulatory in the legs or hamstrings, or maybe they have other musculoskeletal issues and it's referred pain from those areas. And usually the hallmark of the findings is that you find a very stiff spine on examination. There's usually a fixed positional change, very often hyperextended or overly arched in the lower spine. And that certainly predisposes people to these kind of changes. The actual narrowing comes from several things. It comes from the disc space becoming more narrow and squashed, and then just like a sponge, when you stand on it, it pushes pressure backwards, and that disc, if it's under that kind of pressure over a long period of time, becomes solidified. So instead of being a soft material, it becomes a solidified bony material. So that's one cause of narrowing, where the pressure comes from the disc out towards the spine and the nerve roots. But also the joints on either side, what are called the facet joints, which are normally not major weight-bearing joints, when they start to be subjected to more pressure over time, people start to get facet joint pain and can eventually get degenerative change in the facet joints. And that's usually hallmarked by specific pain about an inch off to the side of the midline of the spine. And that's usually the definitive indicator that the facet joints are causing problems. But again, like any other degenerate joint, if the changes are marked, you get extra bone formation around that area, and unfortunately that narrows the space for the nerves too. So sometimes people in those situations just need a debridement, a surgical debridement. But from a physiotherapy perspective, which is my area of expertise, sometimes you can regain mobility around the stiff joints, and it can be enough just to decompress the nerve tissue and stop it getting sensitive. It very much is a trial and error on a case-by-case basis, which you really just have to give a trial course of treatment over 4 or 5 sessions to judge whether conservative management can still help, or whether it needs to go to something more radical. But usually in those kind of cases, if more radical intervention is required, it usually is surgery. There's usually little advantage in any injection techniques, whether it's facet joint blocks, nerve root blocks, or epidurals. There's just too much structural change around the spine. So it's a condition we see frequently, sometimes slips under the radar. The alert clinician needs to look out for it, and you need to recognize when it's capable of responding to conservative treatment, or whether it needs to be escalated and moved on to surgical reviews. So a little bit about spinal stenosis there, not a frequently talked about subject. Hope you found that interesting. I'll see you again on another video. Bye for now.